A snake-guarded shrine used to store illicit drugs in Edo community, Benin City, Edo State, has been raided by operatives of the National Drug Law Enforcement Agency, who detected a specially constructed large hole storage in the wall covered with wallpapers and fetish objects. Different quantities of illicit substances such as methamphetamine, Lord, Colorado, and Arizona, all strong strains of cannabis with a total weight of 8.743 kilograms, were pulled out from the deep hole dug in the wall of the shrine building. The Director, Media and Advocacy of NDLEA, Femi Babafemi, who made this known in a statement, said 2 ladies, Sonia Chinonso and Risikatu Tijani, were arrested during the intelligence-led operation after the big black snake guarding the shrine was demobilized. And to unpack this, I'm joined by the Director, Media and Advocacy, NDLEA, Femi Babafemi. Good afternoon. Glad to have you join me.
Thank you. It's my pleasure being with you on the show. Thank you.
All right. And I mean, there's no doubt that hard drugs are a menace to the society. But how bad is this in Nigeria? I mean, help us understand, give us a clear picture of this.
Well, if we have to get the exact picture of what the drug situation is in Nigeria at the moment, we have to go back to the report of the drug use survey report that was published in 2018 that was conducted by the National Bureau of Statistics with the support of United Nations Office on Drugs and Crime. The report gives us a picture or a figure of 14.3 million Nigerians abusing illicit substances or that had abused illicit substances the previous year. And that translates to 14.4% prevalence rate. And this figure, that survey was actually conducted for those within the age bracket of 15 and 64, meaning that there could have been people under, that way we know as of today that indeed there are people under 15 and those above 64 that are indeed abusing illicit substances. Now, having said that, that establishes or paints a very grim picture of what the drug situation in Nigeria is, because that prevalence rate, 14.4%, that's almost 3 times the global prevalence average of 5.6%. That's bad enough, and we're glad that indeed that really triggered the reawakening of everybody in Nigeria and all the stakeholders to actually wake up to that responsibility of doing something tangible. And since then, especially with the new leadership of the agency that came on board in January 2021, quite a lot of efforts have been put into the fight against substance abuse, either at the level of drug demand reduction or at the level of drug supply reduction.
If I may come in there, you touched on something very interesting. You said 15 to 54 age bracket, most prevalent, people who use illicit substances. I mean, why is that so?
No, the survey actually captured those within the age bracket of 15 and 64. Those are the people. That's the age bracket that the survey actually captured, and that's those are the people accounted for by the survey, and that's where the figure of 14.3 million persons or 14.4% prevalence rate actually came from.
Yeah, I heard you right. I was asking, is there any underlying factors why we have that age bracket, captured as people who use more often illicit drugs?
Actually, globally, it's not just something that is restricted to Nigeria. We know that drug use prevalence is, drug use is actually more prevalent among our youth, the youth population, and the same thing applicable here in Nigeria. So that's why we have majority of those captured in that survey as likely the youth population. But beyond that, there are quite a number of other factors. Maybe you want to talk about the factors responsible for, the predisposing factor responsible for foiling people going into substance abuse. If we have to discuss that, that's quite a number of such factors, ranging from socioeconomic factors to parenting, that's poor parenting, that's at the family level, to environmental issues, peer pressure, as well as social media, which is another factor, because we see quite a
Okay, just to follow up on what you said, you listed a number of reasons why we have these prevalence in that age bracket of those who use illicit drugs. But then how is the NDLEA responding to these challenges? I mean, what strategies are being implemented, and how successful would you rate them so far?
Absolutely. When you look at especially like, let me just bring our strategies on from two pillars. First, the drug supply reduction, and that's the law enforcement angle of our job. That's the area where we make arrests, we make seizures, we prosecute, and also go after the assets of the traffickers and the bearers. All that, I can tell you, in the last 3 years, there has been quite a lot of effort in that regard. We made more than 50,000 arrests, and I can tell you also that indeed within the same period, more than 9,000 offenders have been successfully prosecuted and convicted and serving jail terms in court, which is probably one of the highest in the world, if not the highest, within a space of 3 years, over 9,000 convictions, as well as more than 7.6 million kilograms of assorted illicit drugs also seized, which also ranks as one of the highest, if not the highest in the world, within the same, within that same period. And when you also look at effort in the area of drug demand reduction, because as we are cutting the supply and access to these illicit substances, we also have to face the demand reduction, where we try to discourage people from going into substance abuse. And one of the key factors in this area, one of the steps that the agency has taken, is to put in place a social advocacy initiative, which we call War Against Drug Abuse Social Advocacy Campaign, WADA Social Advocacy Campaign, which was indeed launched on June 26, 2021, to mobilize the citizenry to buy in and take ownership of the fight against substance abuse. That's raising the awareness, and that's where you see officers and men across every part of the country going to schools, going to churches, going to mosques, going to workplaces, going to communities to speak to them, to sensitize them about the dangers of substance abuse, just to raise awareness. That takes care of prevention, raising awareness, because people need to understand the dangers inherent in this. And for those that are already abusing illicit substances, we also have 30 treatment and counseling centers in our commands across the country to also take care of these people, in addition to our call center, where we have mental health experts,
Mr. Babafemi,
psychologists, psychotherapists.
I wish we had more time, but indeed, yes, I agree with you. All hands must be on deck to ensure we eradicate or eliminate illicit use of drugs. Well, thank you so much once again for your time. Femi Babafemi, Director, Media and Advocacy for NDLEA. Many thanks once again.
Always my pleasure being with you. Thank you.